There are communities that are like waiting for solutions with regards to those disasters that have affected them in the past, looking for prevention means, in particular to the health hazards and the impact that have affected them in the past, how solutions can be given to help improve their situation. In Cameroon, we have the Cameroon volcanic line, and we have Mount Cameroon, which is an active volcano. And at the flanks of Mount Cameroon, we have the cities of Buea and Limbe that have been affected by hazards from this volcano, in particularly volcanic ash, lava flows, earthquakes in the past, and that have resulted in disastrous situation that has affected the population. And it's a similar situation in the Democratic Republic of Congo, where we have Mount Nyiragongo and Mount Nyamuragira that are found along the East African Rift. And there have been situations in the past where disasters have occurred as a consequence of eruptions from this volcano that has destroyed the city of Goma. The health effects, like for the volcanic ash, we have increased cases of respiratory problems. We have cases of eye attacks, blindness, lung disease. And then for the carbon dioxide, high concentration of carbon dioxide, there have been cases of headaches that people have experienced, cases of asphyxiation that has led to the death of people. And then we also have cases of high fluorine content that has led to the staining of teeth of the inhabitants in that area. So they have some marks on their teeth that has affected them. So in the case of carbon dioxide concentration, there have been cases where people have built houses on fractures that release this carbon dioxide, and then it affects people like headaches and things like that. So most often you have the women and the children who spend most of their times at home, so they are the most affected by this particular hazard. We have discovered that there are some councils that are already doing a lot with regards to mitigating and preventing some of these hazards. So we have found out that like for a situation like for floods in particular, in the city of Limbe in Cameroon, they have put in place a lot of structural measures, trying to clear off drains, trying to work more on the waste disposal practices. And then in a country like the Democratic Republic of Congo, with regards to monitoring these volcanic hazards, they have the Belgian government that has come in and is trying to help them to get using satellite images to monitor and to give out periodic messages to the population on the situation of the volcano, therefore keeping them on the alert. But in the city of Buea, we still had a lot to do with regards to monitoring and trying to prevent these hazards of volcanic eruptions taking the people unprecedented or unpredicted. We are working with the councils, the universities, the Volcano Observatory in the Democratic Republic of Congo. We work with stakeholders, the government, the civil society, and the community. We brought them from the very beginning, and then we developed the research questions with them, so they have an interest from the very onset, and they are really ready to get the outcome and to implement it into policies at the end of it. At the end of the project, we intend to see an improvement in the way the local government, the councils, the civil society will respond to cases of disasters, because since we are in the active zone, so they are recurrent, the frequency is high. So we intend to see a more positive response and a reduced amount of impact on the population.